Hello, I'm John Kanellopoulos from Athens, Greece, clinical professor of ophthalmology at NYU Medical School in New York. Here, classic hyperope angle kappa and the topography-guided treatment with the wave-light refractive suite, seeing the FS200 laser, doing a hyperopic flap in just seconds. And this is the flap report. You can see how we made the flap eccentric to the pupillary center to match the topographic guided plan. Fold the flap onto itself. Here's the topographic guided hyperopic correction. This is very high hyperope, about +5. And then at the end of the procedure, our signature hyperopic LASIKXtra. I'm protecting the flap with a dry sponge, placing a drop of 0.1% riboflavin in saline solution made by Avedro, and spreading the drop just on the exposed stromal surface, as you can see here. This is the microscope of the X500 excimer laser of the refractive suite. Seeing some side view here. Soaking time is just 1 minute. Here's the second drop of riboflavin, and please note that the flap does not receive any riboflavin, and that's the whole purpose of the procedure we described several years ago. We're irrigating now, and the purpose is to have UV light go through the flap and cross-link the underlying stroma. We're repositioning the flap, I think a very important step in our technique. Using a milky drop to delineate the gutter, and then a Johnston applanator to iron out any micro kinks within the flap. Again, one more drop of milky steroid suspension. You'll see it coming in now, and making sure the flap sits in place. And this would be the way I would end the procedure. In LASIKXtra, we will add 80 seconds, as you can see here, of 30 milliwatts per centimeter square. Again, 80 seconds with 30 milliwatts per centimeter square with the KXL1 by Avedro. You can see here centering the beam, some close-ups, seeing that the cross-linking takes place only in the area that has been soaked. The UV light goes through the flap that has not been soaked with the solution, removing the KXL device, a few drops of antibiotic, and then a bandage lens. We'll see some images of OCT scans the first day seen here, and you can see the hyper-reflectivity in the flap interface. You can see the dramatic steepening of this very significantly hyperopic patient from the hyperopic LASIKXtra, and our study published in JRS this year confirms that this effect seen here again, clear hyper-reflectivity on the cornea OCT, shows, as we've shown in the study, a significant hold of the hyperopic LASIKXtra effect for years to come. Hyperopic LASIKXtra, and thank you very much for your attention. This is John Kanellopoulos signing off.